Bonnell?
Here.
Dr. Zollett?
Here.
And we have okay, so we obviously have someone that we didn't call the roll for, and that's Dr. Patrick, and he has submitted a letter of resignation, unfortunately. So we're not sure if we need to officially make a motion to accept his resignation or not, but we'll go ahead and do that just out of abundance of caution. Of course, we are grateful for all the time that he has spent on the Board of Health, and
Yes.
hopefully he can give us some input still as he goes and watches us on the YouTube.
Yes.
So, do we have a motion to accept Dr. Patrick's letter of resignation?
So moved. Second.
All in favor? All opposed? Okay, the motion passes. Thank you, Dr. Patrick. Hopefully you'll watch us. Then next we have citizen comments. Seeing no one else here, I'm going to assume we have no citizen comments. And we have the approval of minutes, March 2023. Do we have any questions about the minutes or corrections? Okay, do we have a motion to approve the March 2023 minutes?
So moved. Second.
All in favor? All opposed? Okay, minutes are approved. We have the March 2023 financial report. Any comments or questions on that one? Okay, do we have a motion to receive and file the financial report for March of 2023?
Second.
All in favor? All opposed? All right, financial report has been received and filed. Next, we have an education presentation on breast cancer from Dr. Dimon.
Yes. Continuing in the vein of screening and prevention from last month, we're going to do breast cancer today. So, if I can get this to work, I'm told I'll just click on it. Okay, we'll do it this way. So, breast cancer. It's obviously cancer formed from the cells of breast tissue. Second most common cancer diagnosis in women. There's several types. We're not going to break down all of them. We'd be here half the day if we get into too deep. Obviously, women are affected much more than men. It is a cancer of men as well, but the numbers are much smaller. 30% of all new cases of cancer in the U.S. are breast cancer diagnoses each year. It is age dependent, so the older you are, the more risk you have, with the highest incidence being 70 to 74, and 1 in 8 women will develop breast cancer at some point in their life. So symptoms. Obviously the goal with breast cancer is to never have symptoms. To find it before there's any problem or you even know anything is wrong. But some women don't always, all of us, don't always get our screening test as we should, so sometimes it's found a little later than we'd like. Symptoms of breast cancer would be a lump or thickening of the breast tissue, something the patient notices when they're taking a shower or doing a self-breast exam. Changes in size or shape of the breast, changes in skin over the breast, and newly inverted nipples. So instead of the nipples protruding out, they're actually start to protrude in. Okay.
Am I in the
Now
way?
just jump a couple.
Right to the end.
Okay, so risks and causes. I mean, you can't really say cause. We don't really know exactly with cancer what causes it per se, but things that increase your risk, obviously again, is being female. You have much higher incidence of breast cancer in females than in men. As I mentioned, age. With increasing age, you get increasing risk. A prior breast abnormality. So you've had some sort of atypical, a previous lump, a biopsy, and it may not have been cancer, but it was some sort of atypical cells or maybe a carcinoma in situ. A prior breast abnormality is going to put you at much increased risk for later developing breast cancer. Family history. Only about 5 to 10%, despite what's kind of the common thought, only about 5 to 10% of breast cancers are linked to a genetic anomaly that we know of. So again, medicine's always kind of evolving, and we're discovering new things all the time, but at present, we know of 5 to 10% being genetically linked with a family history. Family history being, again, first-degree relative. So mother, sister, daughter, increases your risk. The one genetic trait that we do know has significant risk, is kind of the most common one looked for at this point, is BRCA1 and BRCA2, significantly increases your risk. If a woman is found to have breast cancer and they're tested for this, then typically they're recommended that all female family members should get checked as well, just because of the high risk of cancer. That doesn't mean you're guaranteed to have it. It's one of the problems with genetic testing. So you can find out you have the gene and you never get breast cancer, but it does increase your risk significantly. Radiation exposure. So having a prior cancer or tumor, age 10 to 30, and you get radiation to the chest, increases your risk of developing breast cancer later in life. Again, the common one we seem to always see on all these prevention things is obesity. Living a somewhat unhealthy lifestyle, eating poorly, not exercising, being overweight. Alcohol consumption has a small risk to breast cancer risk, and hormone exposure. So I kind of worded it that way because there's several different things that play into that. If you have early onset of menstrual cycles, so you're young when you start having menstrual cycles, or late in having menopause, or the both. So if you get a longer history of having menstrual or hormone cycles, then it increases your risk of breast cancer. If you're on oral contraceptive pills for several years, slight increased risk of breast cancer. The big one is hormone replacement therapy after menopause. Does have a link to breast cancer, particularly if it's used as a progesterone compound in combination with estrogen. That is dose dependent and it is time dependent. So all this is kind of dependent on your level of hormone exposure throughout your life. Increases your risk. Prevention is the biggie with these things we've been talking about the last couple months. Not finding it because you find some big mass in your breast, but finding it long before it becomes anything. So screening things. The breast exam has kind of been, for years, was the hallmark. Women were always encouraged to do it every month, check in the shower. There's a lot of debate about that now. If you're doing your annual mammograms, whether that actually provides any value at all. The biggie is the annual mammogram. And even that, there's differing opinions on when do you start, how often do you do it, how long do you do it. The general consensus is somewhere between 40 and 44, you start doing annual mammograms. 45 to 50, you're definitely kind of kicking it in. 50 to 75, again, the recommendations are a little bit different depending on who you listen to. It's either annually or definitely every 2 years. And then after 75, again, the recommendations get a little complicated, but the general consensus there is you look at the person, the patient. What's their longevity? How long do you guess they have to live? What's their risk? If they have good quality of life and you expect them to live 5 to 10 years longer or more, then they probably still should be doing their mammogram screenings. My mom was 82. She was still doing her annual mammograms, found breast cancer at 82, had a lumpectomy and radiation, and she's now 88 and still driving, going strong. So age does not really preclude stopping screening in my book, in most cases. And then, of course, if they're high risk. If they're high risk, so they family history of 2 or more relatives, family history of BRCA, even if they haven't tested, you're actually going to start at 30. So you start screening mammograms with or without MRIs at age 30. You want to keep your alcohol in moderation or even none. Maintain a healthy weight. Mediterranean diet has some minor evidence in preventing breast cancer. Exercise, everything combined into keeping a healthy weight. And then again, limit your hormone exposure. So if you do go through menopause and you have pretty bad symptoms, it's okay to be on HRT after menopause, but you want to use the lowest dose for the shortest amount of time that is reasonable. The diagnosis, again, the hallmark is mammogram. Getting an annual mammogram, if you find an abnormality or something that's questionable, then typically they'll do an ultrasound to rule out whether it's a cyst or something solid. Breast MRIs are very good, but they're very expensive, and insurance makes it very hard to get them in most cases. And the hallmark, though, is breast biopsy. So when you've got an abnormality, the ultrasound confirms it's solid. Pretty much going to go to a breast biopsy, get a sample of the tissue, and decide what it is that's in there. Treatment, and the hallmark is surgery. Get it out. Get it out as early as you can, as quick as you can. years ago, the hallmark was mastectomy, removing the entire breast, doing a pretty complicated node dissection of the whole armpit. Nowadays, those are pretty rare, reserved for larger tumors, worries of metastases in the lymph nodes. Most things nowadays are lumpectomies, which is a much smaller portion of the breast that's removed, maybe a sentinel node biopsy, but still, it's to get the tumor out as quickly as you can. Radiation, depending on the type of cancer, radiation is often an augment to surgery. Chemotherapy is when it's a much higher risk, much more aggressive cancer, or you think there's already been metastases from the original site. Hormone blocking therapy comes afterwards. Usually for 5 years, you stay on something to block, particularly if they're estrogen or progesterone sensitive cancers. And then immunotherapy is ever evolving, kind of the forefront of cancer treatment now in most cases. But in this case, the other treatments are so successful that it's really kind of reserved for when you don't have one of the other options. 5-year survival in 1975 was 75%. Now it's 90%. So that's with all levels of cancers, of breast, all metastases, all forms of it. So it's incredibly high survival rate. That number's driven so high by early detection. I mean, the number of deaths are going down because more and more cases are being caught before they ever become metastatic and can be cured. So again, the key to most of these things I've been talking about is screening and prevention. If you can prevent the cancer or treat it very early on, that's what we're all after in public health. That's my presentation. Any questions?
Thank you very much.
Very good, very good.
Okay, that brings us to old business. Fab?
Yes, keeping Fab on your radar. We will be going tomorrow for another CHA meeting with Butler County. So, and Ruth, I think Ruth has been hanging out with us during this time, and it's important because when we go through our next accreditation cycle, they always want one board involvement type thing, but this is the CHA is Community Health Assessment, reminding you. And it's at Butler County's ESC tomorrow at 10 o'clock, Chandra? I think it's at 10. I think it's at 10 o'clock. And we are still doing our survey. Thank you for the shout out for the survey. That was really good. We'll find out how many numbers we have and who we're missing, or are we collecting really good data. Usually it's hard to find men to take the surveys sometimes, but so we're looking at that too. And seniors, making sure that we get all the pockets of targeted populations. And I think that's it. We'll be shortly starting our focus groups. And focus groups are primary data. And so once we decide what we're gonna really target, if we're targeting, say, infant mortality, we'll try to look for mothers that and childbearing ages. If we're looking at abuse, substance abuse, whatever, then we'll target that population. So we have to decide what it is, and then we have focus groups. Kind of go a little deeper, person to person. They first take the survey, and then we talk a little deeper. So why aren't you going to the doctor, or when did you first start using drugs, or whatever topic we are. So that will be coming up shortly, but we're moving right along. This is just the beginning of the next 5-year phase of accreditation, so that's all that's going on with FAB.
Okay. And then we got tobacco 21 on here.
Yeah, just putting on your radar again, tobacco 21. We will be, Carla and I had met with Interact for Health. They have a grant, and it's not a sensitive grant, because for health departments, just earmarked money to help us get these off the ground. And so our tobacco 21, that's licensing. So make sure you guys stop me if we haven't talked about this before and repeating it, but you have to be 21 years of age before you buy tobacco. Tobacco 21 is all about preventing under 21-year-olds to buy tobacco. Hopefully they won't use it, making it harder to get to. And so when we license them, we should start issuing license in January for $250. I think that's where we landed on. That's what Hamilton City's doing. And if we catch them selling, they get a fine, another fine, then the board can revoke their license if they want to, suspend their license, etc. Just discouraging, facilities from selling to minors. Just a sidebar in my packet, Chief Burke called me and said, we're, doing a raid on this vape shop if you wanna come in and see what it all looks like, so, Olivia and I.
Put your battle gear on.
Yeah, and I said, oh Lord, I'm too old for this. So Olivia and I, she's young, she knew what everything looks like, so Olivia, I think, is 22. I think she's 22. So we take in my car, I said, put your seatbelt on, and she looks like a baby, but it was amazing in those shops. This is the one that's on University and, Central, right there in the corner, like right across from Rite Aid. And I love all these big pipes these big hookah pipes and all these things are supposed to be for tobacco. I'm like thinking all these water pipes and all that kind of stuff. And it's different ways that they can kind of try to get around selling certain things. A step called Delta 8 and Delta 9. They put stickers across the top of them saying they're 8, but they may not be. I think Delta 8 and 9 has something to do with the ingredients in the THC or whatever, and you can sell it if you're a dispensary. But if you're just a regular mom and pop shop or store, you're not supposed to sell them. So those kind of things. So they confiscated some of those, and I said, are we on camera? And they said, yeah, and I was kind of waving around or whatever, but they have everything in those stores. And they said the other store, I guess these stores may be owned by one person, but they had cats in the other one. They said it was like 13 cats, all in the cases, and what, yeah.
That's nice, the sepsis and the septic technique for sure.
So anyway, he said, just want you to see what you're gonna be doing, so, it'll be interesting. We're gonna keep really close tabs on how Hamilton's doing, as well as the, Cincinnati, and kind of see what what they wish they would have done on the front end, cause maybe we can be tighter, maybe we can have, we wanted to have reasonable license costs, but maybe we'll say $250 to license, and then the first fine is $500, second one's $1,500. I mean, and the third one, you can maybe take their license. Understanding if we revoke their license, they are not allowed to sell tobacco and tobacco products and vape products. So that's fine for like other stores if they're Speedway and Kroger's, but these little vape shops will probably just need to close because everything in it pretty much, other than the water pipes, are tobacco products, like their cigarettes and their cigars. But then it's these other things that look like it's a bullet shell, kind of like but it's not. It's a round tube like this, and you open it up, and it has like little smokes or something in there. Just one type of cigarette. It looks strange. It looks like small and then bigger at the end, and you light it, and that has THC in it too. But they're in a box, and you could they come in like little cylinders about this tall, this round. And so it was pretty interesting to go in there. And I said, what are these? And they're kind of like joints already rolled, but they have a mixture of tobacco and THC and different things. It's really interesting. None of it appears to be healthy. I keep wondering, like,
I have a bunch of questions. So, okay, say that there was a violation in Middletown.
Mm-hmm.
We cite them, they pay their fine or they close. That nothing keeps them from opening up in Fairfield or in Hamilton.
Mm-hmm.
Are we gonna share with our neighboring cities the violations? Because if they don't cross borders, are they just gonna shift from one place to another or open up a new LLC, which is what happens with liquor sales right now?
Right.
So,
I think that
someone's cousin owns the store,
Mm-hmm.
doesn't pay their liquor sales tax, state, they're about to be, I don't know, get their hand slapped for that or be shut down, and then other cousin buys the store under a new name and everything's good and we avoid taxes in this case. I'm trying to think of, I could see this happening where because it's a local thing, we are the only ones who have the list of violations.
Right. I do believe, and I can check, because this would not be in our regular system, would, because on our regular system, you can see everything, everybody can see it. But at the end of the month, we have our spring conference, and I was gonna talk to the health commissioners, because there'll be the Cincinnati health commissioner there, and we always, talk extensively about what's going on in our cities, and we can talk about sharing that data, cause you're right. I think the maybe we can talk about this from our other departments, but zoning. That store just looks terrible. If you were to go into the store, it looks bad, right? But then they have the back end, you guys, and so if you were to look, the front door is like on facing Central. And then if you go down towards, not Crawford, but you're going down Crawford, and before you turn the corner, it's trash in there. There are bags and bags and bags and bags.
That comes down to code enforcement.
Yes, of trash in there, and it, wait a minute, I thought it was just maybe paper. You know, I always call that clean trash. No, I saw cans and that kind of stuff, which we call rodent rats. You know what I mean? I saw other, you know, things in the trash. So I was gonna make sure they knew that back there, cause it's like they're not taking their trash out unless they produce that much trash in a week. I mean, it was like kitchen bags full of trash bags
Did you
in there.
submit a complaint to code enforcement, because they need to?
Yeah. So I would check, Jamie was showing me all
Do
of
you all
this, so-
know that you can submit complaints about code enforcement? Everyone in Middletown on citizenserve.gov. I will send the link out, Jackie can share it with you, please.
Yeah.
What local property is that?
It's right there across the railroad tracks. If you were coming down Central, as soon as you cross over the railroad tracks, cross over,
Yeah.
that's University, it's right there to the right. It's right there on the right.
One of their first,
Right next to the gin place,
the gin.
the gin shop,
I don't know what.
gin mill or
Gin
whatever.
mill.
Oh, the bar?
Where is it?
Yeah,
I was gonna say, you said gin
Bruce,
shop.
is it?
the gin mill.
Yeah.
Hell, it's been there.
Now,
Yeah.
now Sally
years.
knows.
Like
Yeah.
pager slash.
Yeah, they used to have
I'm not
cell
joking
phones and
either.
all that kind of stuff.
Yeah.
Since I was a kid.
So, so
And
you
then-
mentioned zoning.
Zoning.
One of the, so I met with, Hamilton and Fairfield mayors specifically about vaping and tobacco 21, and, a few things came out of that. One, Hamilton's doing a zoning, they did, they went through their planning and zoning commission and created buffers around schools and something else.
Parks.
Maybe parks.
Yeah.
Another way of controlling some of this is retail density, and I know I mentioned that to you. They did not instill a retail density number at Hamilton, and when we talked about it, they were like, ooh, kinda wish we'd have done it. And I feel like we are still at the point where we could have a retail density, so we only sell a certain number of tobacco retail licenses.
Is that an ordinance? How
It would,
that be?
I think it might have to be, but I think it might have, I don't know, that's a
Okay.
legal question for
Okay.
sure, and Ben said he was looking into it, I
Right.
think. But we're over the recommended retail density number right now without having done the licenses, so we would have to grandfather stores in. Christina?
Yeah, Christina.
Christina, who's working on all this, she sent, some recommended retail density numbers out of California, some cities. But essentially, we, I don't know if it's Board of Health, I think it's Board of Health, maybe, would set the number, I'm not sure. But whatever we want is the retail density number, and then
Thanks, John.
thank you, once these licenses are either given up, the initial ones, because they've either moved or closed down or whatever, then that license would not be active again, because we're over the number. And I personally would like to propose that we have a minimum of a retail density. We should probably look into the zoning. I don't know the effectiveness of that, but the concept is that it makes it harder for kids to gain access to this stuff. I don't know how much of a problem that is. I haven't looked at where our current vape shop are. And
Well, Carla did a map, and our map is heavily saturated in our zones.
okay.
I mean, it starts getting more sparse out when towards the east end, but it usually tends to be neighborhood shops. And so you'll usually see them, all of that kind of, what do you call it, mixed use areas, more in your older parts of town, your downtown parts of town, your poorer neighborhoods, because they have mixed stores. You don't usually have you know, in the East End, we didn't have grocery stores like we did down here, like those little stores, so they're heavy down here. And we have like 70, I think, or a little over 77, did Carla say? I think we're around around that area of retailers that sell tobacco. But she's also said some people are not going to, they just don't wanna fool with it, so that's a yay, because they can do everything except tobacco and tobacco products and that kind of stuff. So you're right, we can check that, but 77 sounds like a lot, you guys, but it's Kroger's, it's all your gas stations, so picture all your gas stations, and then there are all your supermarkets, and then all of those stores that sell, just picture if you say tobacco, cigarettes, wherever you can find those. So I agree with that, we can look, she did have a map though, she was
So
working on
there's
that
two
map.
ways of doing the retailer density. One is just an overall number. Another one is to chunk out the city and say, okay, we have an overall number, but then within each area, this area can only have this many, so that you're spreading them out as well.
Mhm.
But the numbers that were recommended, it's like 1 per every 2,000 citizens. I mean, that's 26 total.
That's pretty cool.
I mean, we're
yes.
talking like, we would have a third of what we currently have right now, which
Mhm.
would be great.
That would be good.
I mean, we're not getting the sales tax from it as a city, from an economic perspective.
I had
Um,
heard they make $4,000 a day.
Yeah, I don't have an eighty, now, I'm
That's
also,
why I was just hearing, I said, that's pretty
Wow.
good.
I
said,
also hesitate to like have so much government overreach, right, where at what point, people need to make their own decisions, right? So I recognize that as well. I just recognize this societal impact we're all paying now because of this vice. So I hesitate with everything. I hate creating more rules. But if we're gonna do it, we may wanna look into retailer density. The other thing that came up was the sales of Kratom.
Mhm.
I don't know if you guys know anything about Kratom. I'd never heard of it. Okay, so apparently it is it's psychedelic
Yeah.
in high doses, and it's very addictive. There's no medicinal value. It sounds like something that should be banned at the state level. There's multiple states that have banned it. I think at least 5. I know Florida has banned it. I think Alabama. I can't remember the full list. It went to the state house. Apparently, this is Mayor Mueller said it went to the state house in Ohio, and there's some lobbying group, some political something. It didn't go anywhere. So like, it's not gonna be banned in Ohio anytime soon. So Hamilton was looking into if they could individually, as a city, and maybe Butler County cities could ban the sale of Kratom
Yeah.
locally. So there's something else that we could discuss.
Discuss there.
Fairfield did not have tobacco or retail licensing on its radar at all until a week ago, really, at least the mayor did. So we're definitely ahead of, a lot of other cities. Oxford is going to, yeah.
The hard thing about Butler County, you have to go to each municipality, so you have to go to the townships and the cities, and instead of just do it, Middletown and Hamilton is a little easier to do that.
Yeah, so, what do you guys, I'd like to hear everybody's thoughts on retail density, on zoning, on how much overreach. I'm just curious, what are your thoughts on it? If we're at 70-some shops now,
Yeah, but what percentage are the mom and pop versus the gas stations,
Yeah,
the grocery
didn't-
stores, cause,
The true vape stores.
yeah.
Yeah, I think Carla said that there were only, when I say only, it seems like she said there were only 7 vape stores, just strictly, I think
Yeah.
it's a small.
Yeah, that's.
one just
that's-
opened on Central.
Yeah, I think these are just strictly
Downtown.
vape stores.
Yeah.
Not gas stations, not, yeah. I thought
Only
she said-
7?
I thought she said 7, didn't she, did you
Something
remember
like
something?
that,
It's
'cause the
a low
majority-
number, cause I thought,
Majority's gas stations,
Yeah.
drive-throughs.
Now,
yeah,
but
okay,
by gas stations, do we mean convenience stores?
no, I.
Because most of those thrive only on alcohol and tobacco. I think we're, cause if you look at like, I'm just using it as an example, King's Market drive-through. I popped in there yesterday, cause I'm like,
Where was
I
that?
just kind of am curious about this.
Where's that one?
On,
I may not know.
hang on. On Charles,
Mm. Okay.
over, because
Oh,
I
yeah.
know across the street they get a lot of, tobacco use into the, bar across the street. I see it on here all the time that
Right.
they have tobacco use violations. I was like, oh, I'm gonna just stop in.
So I think she
I
can,
mean,
yeah,
we're not gonna call that a vape shop, but let's, like,
that's what it is.
yeah, yeah.
Okay, so we can start saying, what is this, like the one I went to yesterday, it would, I don't think anything in there really edible unless you just wanted to eat something else.
That's a true vape store.
So that just looked like
Yeah.
vape straight out. And then, you know, the one that's next to Bourbon's,
Yeah,
that has everything in it.
and
That
that's
has
more of what I'm
tops,
talking
I
about,
mean,
but
potato
there's
chips
a
and
ton of
everything.
those that are,
Right.
probably a large percentage of their sales
Right.
are from.
Oh, well, of course, they're gonna be,
Mhm.
yeah,
That place is literally called Discount Smokes.
yeah, yeah. So we can check and see which one are just straight vape stores, which one are convenient, heavily vape, and then which one are corner stores, and then which one are supermarkets. You know what I mean? We can kind
Right.
of label those out, so we'll get that information, we can get that. Carla may already have all of that information. Yeah, but, yeah, we have to look and see about, they had everything in there. I don't, you guys else kind of,
So what is your, I mean, do you think that the Myers of the world are, is that a okay, is that better than the vape shop? I don't, what is the thought? I don't.
I've never been in a vape shop, so, but, I mean, they are popping up everywhere, but I'm just saying, if you're gonna take it from 70 to 20, that's a lot of businesses. That
Yeah,
majority
there
of their
was-
sales are gonna be,
There was also a 1 to
Apple and
4,000, there was a 1 to 2,000 recommendation and a 1 to 4,000. So obviously big difference, right, like twice the number
Right.
of licenses, but that's the range of where I saw the recommendation.
If you think about it though, if your goal is to get it down to the 1 to 2,000, it's gonna take a significant amount of time for them to.
Oh, it'll take forever
forever.
for all those to
Right.
get.
So, I mean, you're gonna start off with that high number and through attrition, you'll lose them, but it's gonna take a long time.
The other thing is, if we were to do that, I asked law department about this, we would need to almost need to put a moratorium on the creation of vape shops, because otherwise what's gonna happen is, they know that if they want a license, they gotta get it
Get it
now.
now. It's
And now
coming.
we're just gonna end up with an influx of vape shops, because they know they're gonna get grandfathered in and they'll never get a license again for selling tobacco. So,
So you'd almost have to do
you'd
the
have to put a
zoning thing
moratorium,
first.
like,
so I was hearing you say, what about this, when you were talking about, when we look here on this list, look where look under, the percentage of younger than 17, down this, it's right in this row, the percentage of, in the community that's under 17. So you can look at how maybe it would be not, because Tobacco 21
I'm
talks
not sure
about.
what this is, I don't know what this whole chart is about.
This is, remember, this is our census tracts in Middletown.
Yeah.
This is all of our census tracts in Middletown here, across the side, so
So
let's.
this is the percentage of citizens in that area that are under 17?
Yes,
Okay.
right here, you see, did I do the right one, right here, younger, do you see, yeah, right here, yep.
Okay, got it.
And so looking, if we're trying, Tobacco 21 is trying to make sure that people under 21, that might be the communities that we really look on when you're saying,
Mhm.
you know, I mean, there's ways to maybe say, no more in this area, cause this is where all the kids are saturated. When we were looking at our census tracts, on the east end of town, there's not a lot of kids over there either. So I start saying, well, is that true? Well, almost all my friends on the east end of town, kids are grown, they're out of the house, and so you have the saturation of your kids more in the city. I mean, more towards, and so, I mean, that's just
Yeah,
another way that we
interesting.
can kinda look at the way to do it. But couldn't we, I don't know what they said about the moratorium though. Didn't they say it was hard, or we couldn't do it, or did they say, I don't know, we probably
Well,
just need to have a.
it's because the verbiage is
Okay.
tough to get at, yeah.
Oh, okay,
Yeah, because you would have to do a moratorium on something greater.
okay, then that.
Yeah, like, we had to do one on all medical facilities downtown in order to keep the Suboxone
Yeah, right.
from opening on Central or something like that, so it's like, you can't be, anyway, it's.
You're attracting the sunshine.
Okay.
what about the dispensaries? They were talking about possibly dispensaries, that dispensaries can have some of these products or whatever for it. So that's another thing, where it's.
But those are regulated.
Yeah, they are regulated.
The products are regulated, and I think our issues with a lot of the vaping stores
Right,
is that
they're
they're
not
selling
regulated.
unregulated products, and that's what's really getting people. From everything
So, I don't know if they wanna hear from the rest.
Yeah, anybody else got thoughts?
Well, there's no
The
law
board?
against it, right? Doing vaping in the state or
What-
anything, I mean, you can,
Under 21, yes, and the problem is their sales are happening to those under 21. That's the big.
And they get fined, and I think yesterday they said they will get, that's a criminal,
It's in Ohio.
because
Ohio.
they were finding things, drugs, like drugs, THC, so they can fine them for that. But other,
if you actually make $4,000 a day, maybe you make $2,000 a day, what's the fine? The fine's nothing, and it's cost of doing business.
Well, after a certain number of fines, you lose your license. That's how.
How many's that?
Have we set that yet?
that, I think it is, we did set that. I have to look at the thing. Yeah, I think we did set it, yeah, the times is in there. Carla's been talking to Cincinnati, Hamilton, Cindy Hogg still, trying to see if we can put more teeth in it, or what they're finding. I know that Hamilton, she said something that they have 3 in court now, that they're trying to revoke the license already. So, because they keep selling, like you were saying, they keep selling to the
So Cincinnati
minors.
was it the first city in the state to do the licensing?
I think Cincinnati and Cleveland, it's like somebody,
Okay.
somebody north.
And then I mean, we're on the front edge of the retail licensing, but there are some other cities who've had the track record of starting it. So we're in the education phase to retailers right now.
Carla did say that if we wanted to be bold,
Yes.
I'm just
Oh,
gonna lay it
yeah,
out there.
this is not a good.
a flavored tobacco and that kind of stuff, because I think Cleveland and Columbus, Columbus banned flavored tobacco, and then Cleveland,
That went to the state. That
So
was-
did
Yeah,
SUR
the state said no. To me, I think that's overreaching. I would,
Are
because
those
then
the
we're,
most popular, is that?
at that point, like, adults can't get it either, who legally or should be able to get stuff. But we're not trying, if people have vices and they wanna have their vices, I don't think it's like I don't personally feel like it's our place to say no. But if we limit the number of places they can get things from, it does make it more difficult for our youth to get at it, which is
Yeah.
really where we're, in my mind, that's where
Yeah.
but, like, I really do wanna hear from people and your thoughts, cause this is not an easy topic, and,
but you know what?
but it does set us up for the future. If we're gonna do it, now's when we have to do it right.
So let me
Otherwise-
throw in this, when you say it's not easy, public health is supposed to be about protecting individuals and making them healthier, right? You know there are people that make money that take advantage of people. And so the flavors of the vodkas and the flavors of the tobacco are targeted at youth. So sometimes you have to have this is the other side of it, sometimes you have to have governing bodies that protect those innocent people, in a sense, right? Because they're purposely targeting youth, they're purposely putting things in there that's more addictive. And so that's why you have those standards and those regulations. So it's always, a lot of times we can feel like government's overreaching, but when you have people in there that are really doing bad things purposely, knowing that it's gonna cause harm, and they really don't care. That shop down there, and I'm older, but I'm not like a little wuss. I felt really bad in that shop, cause there was nothing good in that shop, and it's not because I'm older,
Well, here's the
but it
thing,
was
what's-
just
what's the-
nothing good.
You
in that
say
shop.
they have vices, you can have vices. I'm sorry, that's what's the benefit of these places? Nothing. There's
Well,
no
it's like sugar.
there's no benefit to this, yeah, but there's no benefit to this at all, is there? So why do you have to let
that's
every Tom, Dick,
that's the
and Harry that wants to
conversation.
open up a place come in and open it? I mean, if you can't get rid of it completely, if I was running the place, I'd shut them all down. But the bottom line is, since you can't do that, limit the number. It's that way
I mean-
you're able to do what you wanna do to a point, but you can't, you know, get rid of it completely. The best thing to do for your community would be to get rid of all of them, but you can't do that, so limit the number. So go for the 1 and 2,000 or whatever it is, and at least you've done something positive. I mean, there's no benefit to these vaping shops at all, period. I mean, it's like tobacco. Yeah, oh, it's a vice. Yeah, okay, fine. What about the clown that smokes for 20 years and comes in and has no insurance and goes to the hospital and then has to have surgery and radiation and blah, 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 and it's a couple $100,000 to take care of them. And we did nothing, you know, oh, it's their vice. Well, you know, sometimes you have to protect people from their own misgivings or whatever you wanna call it.
Amanda is listed on here twice.
So is Mayfield.
Yeah, those are just the census tracts that feed into that school.
Okay, so there's a few different Amanda tracks then?
Yeah.
Okay. All right.
I think this is what the discussion, I'm sorry, Sally.
But what about the ones that are selling the most? To start there with getting rid of.
But you can't really get rid of them because there's no law that says that you know, they can't be there. But if you could pass some ordinance or whatever you do, I don't know, it's, you know, to limit the number, that would help some of the problem. You can't get rid of all, I mean, the best thing is get rid of all of them, but you can't do that, so limit the
I get
number.
into the thought process then as well, obesity is
I know, like-
arguably even, like,
Let's
is-
take out
Well,
Verity
they
and all
did
the
it,
fast
they
food
did it in
Fast
New York
food.
City, but then they came and, you know, they changed it.
Yeah.
But if you go by that, then it's the Wild West. Let them have, you know, 150
I feel like
of
there's
them.
a happy medium somewhere,
Yeah,
right?
well, that's what you
And
just
we
said.
just gotta
You
figure
brought
out
it
what
up.
it is.
You brought up the happy medium, make it 1 in 2,000 or whatever it
1 in
is,
4,
and you
that's a
cut
good
the
start.
number.
Yeah.
I think we definitely don't need any more.
Right.
I think we can cap it off and then.
Start, yeah.
Right. And I understand you guys, I think what the mayor is trying to do too, good, healthy conversation. We need to discuss how
Yeah,
we're
I mean,
feeling in
that's why
there.
we're
Because
brought it up,
people
for sure.
are, if they watch YouTube or whatever, they're gonna say, well, what was the discussion? So that's the good discussion that you're having. My only thing is, when it's really nice, prosperous, good things for a city, you don't find that. They are, you know, these are in the parts of town that takes
Well, there'll be
advantage
people
of the
that are
kids and
critical.
the, yeah.
I mean, there'll
Right.
be a lot of screaming and yelling and, you know, but that goes along with today, anything.
So if we, I don't know whose role it is to set, if we were to do a retail, first of all, does everyone feel like a retail density is something that you would be interested in
Sure.
pursuing?
Yeah.
Taking kids'
Okay,
traction.
so
Yeah. So I think that's good.
then if that's the case, we're not sure legally who puts that in place. If it was the Board of Health, what would you guys recommend? I saw the 1 in 2,000, the 1 in 4,000. To me, I think somewhere in there is what do you guys think as, if we were to be the ones who recommended to council, or if we were the ones that actually ended up voting on that at some point, where would we wanna put the recommendation?
Well, 26 is better than 70.
Yeah, I mean, I think any of it is gonna be an improvement, but where do we ultimately, long-term, want to end up, right? Because it's gonna take a while to get down to that number, but where do we want it to
0.
sit?
Yeah. So do we, yeah,
I mean, I just figure we might as well like shoot first, we're not wed to it at the moment, right? We're not voting, I'm not proposing we vote. I'm thinking if we can have something that says, hey, the Board of Health is considering at this amount retail density, and then we can start
is
the
1 in
discussion with
4,000?
legal.
Is 1 in 4,000 40?
Well, that only
52?
contains, yeah,
52?
50,000.
Oh, well, duh.
What? Oh,
There you're only
Wait.
talking, what, 10 or 15?
when you said 1 in 4,000.
13, wait, oh, 1 in 4, oh, yeah, we went the other direction with that
Yeah,
one.
go the other, yeah.
Yeah, 1 in 4.
52?
No, it's 13. 24,000.
Oh, it's less.
I
So
was-
why
I
is
was-
it only
4,000.
52,000 people?
Yeah,
So you got
that was less.
4,000
No,
out of
no, 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 no,
52,
no,
you
no,
wanna
no,
go
no, no, no.
2,000
I think
or
it's too
less,
few.
maybe.
I think that's too
Yeah,
few.
that's cute,
I think
yeah.
that's too few.
Cause we're talking anybody who sells tobacco,
Right.
right? Meyer,
Yeah, all of
Kroger.
them.
Yeah,
the
I mean,
dollar
and we
store.
can go the other way too, and, you know, 1 in every 1,000, that's where 52 comes.
But you guys,
Everybody
we
do
can,
math.
when Carla gets back, she'll have that report, she's been working with them, she'll have the report of what they look like, and if it looks like, cause I'm not kidding, I think it was, this was her report, she was saying that someone, it was like it sounded like they were pretty large, they didn't wanna fool with it, it wasn't worth it. And so that was cool, because they have enough sales of other stuff, and so I think if we said only like what, 26, I'm just kidding, they may not have a problem with that. Because to have a tobacco license and to keep it locked up and to worry about checking IDs and stuff might be more of a hassle. And so that may not, overall, may not be a bad thing, because they might think, let's just
So
do
there's
what we
one other
did.
benefit to having a lower retail density is from an enforcement standpoint, when the police are going to make sure we're not selling to minors, now we're actually, we have more resources to be able to check on these places. The more we have, the harder it's gonna be to cover that, and the looser the sales are gonna be. I mean, that's just a fact.
Right. Yeah, that's what Dave
So-
said, I just wanted to show you what you guys are gonna be looking at, these stores, yeah, so, I agree. I mean, I agree with all that.
So do we think 1 in 2,000 is somewhere in that range where we wanna ultimately end up? We kinda start a discussion there with, okay. Thank you for talking to me. Also want to report, no ID sales of tobacco.
Mhm.
I don't go to the Slice, but apparently there's a tobacco vending machine,
Oh, really?
yes, inside the door, which clearly does not require a fee.
They still have them, I guess they.
Yes, and apparently that's where all the under 21 people are very easily getting their, I heard this anecdotally, by the way, not
Well, so if you
officially
know it-
making, like
if you
stating
know
that
it's
but
there-
if that could be somewhere, something with.
If you know it's there, somebody should go in there and tell them, you know.
That's what I'm doing, officially reporting, I heard this last night.
Yeah, I mean.
I'm reporting it so that they can look into that.
Good discussion.
Yeah.
You have all these laws and nobody pays it.
So we are continuing to educate, that's what we're gonna do, when we get this information, we're gonna go into these stores and educate them, what is tobacco, what is a tobacco product, what is vaping, Delta 8 and 9, et cetera, and that they are responsible, so if they said, well, they told us it was 12, you're responsible for whatever you have, and this is how your fines will be, and then you'll meet the board, they come before the board and they can close them or whatever, so that's part of what we're talking about, the education process that we'll be doing for the rest of the year, so we're just gathering all that information. And sending out the applications in November, December, to be starting to do inspections in January. We'll be meeting with the police as well to see how they do their checks, cause they do them with alcohol already, and so they'll be doing alcohol and tobacco. And we'll probably need to set up a meeting with, the law department, just to talk about ordinances and all that. So I'll get with you to see if it's a good time to maybe do that, cause sometimes it takes a while for them to get back with us as far as what they're doing. It'd be nice to put it in as we're educating people, all the legal stuff, I don't know.
Yep.
If we did an ordinance real quick, then is that too late, or do you have to do a moratorium?
I'm afraid if we don't do a moratorium of some sort,
Time will get away with us.
well, no, it's more that people are gonna open up a bunch of vape shops.
Yeah.
Or tobacco sale shops, I should say. But, like, they may just open an LLC. I don't know what you need. Do you need a physical brick and mortar to be approved? That's another question, because if I was a tobacco
How
retailer,
easy
I would
is
go
it?
and open 20 tobacco retail, like
Right.
tobacco sale companies. If you didn't need brick and mortar, I would then file, I mean, you're gonna have to pay for them, but you can then sell them off.
Right.
I don't know.
That was a good idea.
Sorry, I just,
You sound like
I
YouTube
think
and-
like a business person, and I'm like, I mean, there's a business opportunity, right? If
Right.
you get grandfathered in on this thing.
Right.
So we just gotta, that's a legal
Find out.
question, I don't.
Legal, I'll check with
yeah.
them.
I don't wanna see that happen where we're all like, oh, look at us go. We just, inundated our city with okay. Sorry, one other question. Are we wanting to put any sort of zoning restrictions in place? Because that is something that would have to go through planning and zoning as well. As far as proximity to schools, parks, et cetera. Or do we think the retail density aspect is enough?
They're gonna get it.
That would cut it way down.
But having it next to.
It's not gonna cut it down, I think necessarily, it's just gonna move them.
Mhm.
I like the zoning idea.
You do like
Like
that?
both?
Both, yeah.
It's a little more complicated, right? Cause now we've gotta work with zoning and figure out what is that distance. Now Hamilton's got a formula for it. We could take theirs, propose it to planning and zoning. We'll run it by everyone, propose it to planning and zoning. And then throw it in.
Yeah, we can, I mean.
And if
we
they're
can
within the
propose
borders right now, they're
grandfather.
gonna get, I think they have to get grandfathered in, and then if they close, there's no one else can open in that proximity to it. Yeah. We would officially be the most restricted city. Mhm.
Good.
For us.
Yeah, that would be good. So we're gonna look at zoning and retail density, okay. We'll have
So
something.
yeah, if we
to-
grab Hamilton's and then, you could, it could be a new business item at planning and zoning to gauge their appetite the next meeting, bring it here, see what everybody says, and then they could vote on it. I don't get the feeling like anyone here is gonna probably have an issue with whatever that is that Hamilton has.
Yeah.
It's working for them, so maybe if we go under the assumption that if both approve it,
Mhm.
parallel efforts, so that we don't have to drag this out too long.
Sounds
Yeah.
good.
I
All right.
don't even know who has to approve any, I know they have to approve that kind of stuff though.
The zoning?
Yeah.
I don't think they would have a. We'll see. All right.
Gotcha. Thank you. Look at us getting stuff done. Okay, where are we? Anything else on tobacco?
I need a cigarette. I just say that.
Okay,
Just say something.
that brings us
I need
to
a smoke
new
and
business.
coke.
Election of President Pro Tem, oh.
Yeah, so a couple of things, and I was discussing kind of sidebar with the mayor. The clerk of council has sent the resignation to council to let them know that it's an opening on the Board of Health. The council can decide to look at any other previous applications that are there or open it back up. The law department said that it's enough members on the board that we could not have to worry about filling it
Mhm.
immediately, or we could fill it immediately. So it's right now, it'll be in the council's hands. Council will go into executive session and talk about the opening and send us back a proposed member. But in the meantime, Dr. Patrick was the pro tem, and so we would need an election. At first I was gonna say, do you wanna wait, but then we can't really wait because we don't know maybe how long the process will take, or we can just fill in. Everybody's been good to fill in, so it's
Yeah, we should
pretty
probably
much up
just-
to you guys.
So, I mean, we're probably not gonna put a new board member in that role anyway, so.
We just need to have an uneven number of people so we don't jam up a vote.
Yeah, the mayor gets the tie vote.
Oh, is that how that works?
Okay.
It usually, well, we haven't anything controversial, I was gonna say, cause we usually have it voted on really hard items, but
Let's
you're
just
right.
put it this way, I've never voted.
Yes. So, going to do election of the pro tem?
Do we have any?
Or do we wanna just think about it and bring it back? It's up to you guys if you. Now,
Do
the
we have
pro
any
tem just
nominations anyone wants to
fills
put on
in
the
for the
table?
mayor when she's gone,
Yeah.
it's pretty, you just read off it, we'll help anybody through it that wants to do it.
If anyone combinations that would work,
Mhm.
or volunteer.
I know Lisa looks like she's just dying to do it. I was like, she's like.
I haven't been here long enough. Give me a year.
So just read what's here in front of me. Amanda does all the work.
I don't wanna do it.
So we're down to Ruth and Jeff. Oh, yay, okay, so Jeff, thank you, Jeff.
We need a first and a second.
First and second.
We have a motion to appoint,
So moved.
Mr. Rono. All in favor?
Aye.
All opposed? It's official.
Yay, yay, thank you, Jeff.
Thank you for your service. Okay, next, travel authorizations.
It is one, it is my spring conference at the end of this month. All the information's in the packet.
That's a lot of information.
It is, isn't it? Any questions?
Do we have any questions and or motion to approve the travel authorization?
So moved.
Second.
All in favor? All opposed? All right, you have been approved to travel, Jen.
Yay!
Okay, and then we have a grant writer and administrator agreement. Would you like to discuss that one?
Discuss this a little bit. We are embarking on another workforce development grant for 2020. Our 2023 is ending, and ours 2024. No, our 2022 is ending. It's 23 to 27, I think. It goes all the way out. So this is a workforce development money that comes from CDC, to the state, etc., to build up public health workforce. And so we thought we would use this grant person to write the grant, to pay her salary for any other grants and to minister it, right? Instead of, and we're gonna just pretty much, as you'll see contracts in here, just do contracts. Health department doesn't really have a large enough budget to handle people. So we're just contracting in a sense to get the work done with this workforce development grant, doing what it wants us to do, introduce people to public health, as well as receiving some monies to do things in the community, et cetera. So, this application, not application, but the, agreements in the packet. Not to exceed the amount that's in the packet, we can discontinue it at any point. Understanding now, the other person that's paid on the grant, the workforce development grant, is Olivia, our emergency preparedness contractor right now. But we can also hire, I think we approved workforce development Deanna Shores last time. We can help with interns this summer. We can help with some of the tobacco 21 inspections or whatever. We can kind of get people on board to help public health in their different activities, not being city employees, if you will. So,
Is
that's
this a special person that does, I mean, are there people that just do this, or is there a course that you take, or, I mean, to be a grant writer, or how do you?
I think it's all of the above. You can take courses to be a grant writer. They're just, what do you call it, those little, they did little workshops and stuff to do it. But usually good grant writers are successful in writing grants. So most of these people have $1 million grants that they've successfully received. So they've written the grant effectively enough. So, like right now, that Ohio Is grant that we have, Rhonda Malinas, the contract writer on there, grant writer on there, and that's her business, she writes grants.
That's what I.
Yeah,
so there's
Karen Maney is her business that she's gonna write grants.
certain people write grants.
Yeah, and what's kinda nice about it is they don't get paid if they get the grant because they're writing their position in the grant, right? And so if they don't get the grant, they don't get,
Really?
yeah. So you have to pay them for that attempt, but you don't pay them for their hourly services because, so it behooves them to be successful in the grants that they receive, so,
It's a particular skill set.
yeah.
Okay.
Once you get the knack of it, I think it's just you have to be a good writer and get a good narrative in there and then collect all your data. Cause that you have to just prove that whatever you're writing the grant for, it fits the narrative, but, And we'd be happy to share. What I would like to see this grant writer do is take any grants that's out there from Interact for Health, for ODH, for CDC or whatever, make it fit into our Middletown destination plans. You know what I mean? Destination Middletown, so that we're on the same page when we're starting to put things in place. There's a grant to plant trees. There's a grant to make sure mothers have successful babies. There's a grant to make sure addiction and abuse, you know what I mean? So you're kind of, our health department has money and they're partnering with the right people in our community to get the same things done and leverage that. So that's what I'm hoping that she will do. That's our expectations.
Who is she? So this, I don't see a name or anything.
So far, right here, this is Karen Maney that we're probably gonna hire, but this is
This
just a grant.
doesn't go out to a bid or anything?
No. When contracted writers, no.
It also, it says March 2023 in here.
Amanda said she was gonna go online through that, that's when it first went to law.
Okay, that's what I went to, okay. I'm looking here. Yeah, this does not go out to bid. Contract workers are just people that fit the description.
Okay. So, do we have any other questions about the grant writer and administrator agreement? That doesn't make a lot of sense to me personally,
You know,
but
what?
I don't.
That you don't have to go to bid?
No, just
Oh.
the whole thing, it's in, I don't quite understand it, but I'm not voting.
Any questions
I'm sure
from
everyone
anybody?
else gets it, I just,
Yeah.
seems like very muddy.
The contract or the
Yeah, the whole
positions or-
concept.
Of
Yeah.
public health,
Of this particular agreement.
Hospitals hire grant writers to write grants for them.
Right, yeah, I understand that, I just understand what this grant writer is for.
this particular grant writer is gonna write the workforce development grant, that I think is about $600,000. How much is this last
Like
one?
460, I think.
Okay, so, and when you write a grant, you gotta manage it and administer it. We don't have staff to do that, and you gotta put reports in there.
So this is to pay Deanna Shores?
This is, yeah, it's paying Deanna Shores, Olivia, the
Which I
grant
didn't
writer.
understand that one to be.
Yeah. To-
Okay, I feel like we're like 5 levels of
Well,
people writing grants for each other to get paid.
okay, so.
I
this-
know, I'm
right.
probably not
No,
what
you're
it is,
good.
it's just
No,
what it seems
no,
like
but
to
you're
me.
good. Deanna Shores right now was approved for the first workforce development money, because we still have money on that one, but it's ending, right? So the workforce development is about.
Who
getting-
wrote that grant?
Butler County. Butler County wrote the grants because when they had the workforce development grant originally, that contract was with Butler County because all monies went into all counties. This new workforce development is individually dispersed to individual departments, health departments. So we can't work with Butler County anymore. If we wanted this money, we had to write it directly to, yeah. We had to write it directly there. So then we thought, do we want the money? Yeah, we want the money. Do we have time to manage and write the grant? No. Because when Butler County, I don't know if you guys remember the emergency preparedness grants, all of those grants came to counties. And then counties contracted with cities. Now they're doing grants directly to city health departments. So
Okay,
this one goes directly to the
in
city
this
health
case,
department.
we pay 32,000 whether or not we get the grant.
No, she bills us monthly. It's not to exceed the 32.
It's up to 32.
Up to
Mhm.
32,
Mhm.
she bills us monthly $40 an hour.
Right. And she has to say her activities she's doing, so it may or may not be that amount. So if she writes the grant and it's 6 hours to write the grant, it's times that. If she's not working at all, on vacation, not writing the grant, et cetera. So if we don't get this grant, it's mute. I mean, we're not gonna hire,
Right,
workforce
but we
development.
will have paid for services to write the grant.
Right. Yes, which we still have leftover money from the workforce development 22. It's almost finished.
Deanna is the most articulate person I've ever met.
She's cool.
She's
But
so-
Deanna, yeah.
You understand what she's trying to get at. She's just really good.
The good thing about community people is that they know where to find those people that are needed for those focus groups. They're not afraid to go in to get the focus groups. If you say you have to go into certain areas, they can find a way to get to the areas and get that done. Those focus groups shouldn't be done in the evenings and on the weekends. Sometimes it could be a target area that does it during the day, but again, our staff doesn't have the time to go out and do all the focus groups. And if we do the tobacco 21 checks, we gotta find kids as meaning under 21, to go out with the police to help with, with those, tobacco checks too. And so that'll be all part of that process too, if they come in. We're gonna have a meeting tomorrow to talk about interns. People wanna intern with us. If we start doing internships, do we pay them, not pay them, and then who's over them, and who takes care of them? That could be a Deanna staff too, because Deanna is just under the contract of a public health worker. So it's just giving you more workers that do public health to get things done, but. Now, if they became a city employee, that would be more of a job description, structured, because they would then get into all the rest of the obligations of a city employee, health department person. And I think we can control them pretty easy, because if we want them to work 10 hours, they can work 10 hours. If we only have 2, they can work 2. It can go up and down as far as how much you actually use them. A little more comfortable? Look.
Any other questions about the grant writer? Do we have a motion to approve the grant writer and administrator agreement? Second? Anyone second? Second. All in favor? Opposed? Okay, it's approved. And we've got the name, address, phone, health history form update. Do you want to mention that?
Yes, this is easier. NAP forms are for health board members, city council members, all the department heads, police and fire. And that's who the health department makes sure that we have current information on their current status. If we had an anthrax attack and we had to give antibiotics out and we have to mobilize our health board, our city council, whatever, we would automatically vaccinate you guys or prophylax you guys first, and then you guys then go out and help us accomplish whatever. So this is just an emergency form that everybody does yearly, because things change. You get older, you might be pregnant, you might have children that you didn't have. So on this form, you need to fill it out and then just give it back to Amanda. And it just keeps us current on when we do the count of how much antibiotics we need or whatever we need, you guys are in that count. So any questions with that? And you've gotten this before, haven't you, received this in that form?
Okay.
No questions? Just make sure you send it back in to Amanda or bring it back the next.
Next item is the 2023 first quarter report.
We don't vote on it, we just receive it.
Okay, but we don't have to vote to receive it.
Nope.
It's in your packet.
You don't go back.
All right, health commissioner report.
You all received the handout. I think the most exciting thing, a couple exciting things, but the Ohio Is grant is getting down to the bus ride of See My Neighborhood. So the Ohio Is grant was the grant that we were dealing with the census tracts with the highest CVIs, which is the Social Vulnerability Index. And so we met with ambassadors in the community. We're talking about their neighborhoods. So these first census tracts, which was 130, 131, and 132, are getting ready to take the city leaders. And that, when I say city leaders, it's not just this organization, it's hospitals, it's FQHCs on a bus ride in their neighborhood. And so the See Your Neighborhood is the bus ride, and then walk and talks that happen after this will be census tract 130, 131, 132. They'll walk the neighborhood with the city leaders. Let them see their neighborhood, talk about the things that they like, they don't like, the things they wish they had, etc. So this is a part of engaging neighbors and our citizens in the process of taking back their communities and their neighborhoods. Remember, we talked about some didn't like the loose dogs in the neighborhoods, and so we have the dog warden working with the neighborhoods to try to get loose dogs, or dogs that run around out of the neighborhood. I was in one of these neighborhoods and I couldn't even get out the car. It was like 6 dogs running around. They looked friendly enough, but you couldn't tell if they were. And it was a bad dog bite in this neighborhood, so I wasn't getting out the car. So anyway, this, anybody that wants to go on these walks and talks and rides, I will give you the information. Good, Sally wants to go, I'll give you the information as well, but we were inviting, I'll go back over this again. At the top, we wrote the grant, Ohio is grant, to focus on these census tracts that had the worst health outcomes: mental health, physical health, educational health, etc. And we worked on the 3. Rosa Parks is the area that we're working on. The next 3 tracks will be strongly Amanda area, and we'll just keep rolling out in the neighborhoods, trying to engage neighborhoods into doing something about their neighborhood. Finding some empowerment, if you will, because a lot of them have come out and they say that they want to clean up their neighborhoods. They just need, what do you call it, those big dumpsters. And before, they got in trouble because the dumpster didn't get picked up until Monday and somebody put couches in it, and they got in trouble. So anyway, they're just trying to get some communication with our city leaders. Some of them say they would love to go to the doctor, but they can't get into the doctor. So they're gonna talk to their health professionals at that time. So you'll just hear from the community. Everybody is wondering why they can't get into the certain areas. I work with the hospitals and the FQHCs all the time, and they can't get people in, or they can't get people to come get mammograms, or they can't get, and we find out that they can't get in because no transportation or no opening. I have heard people that said they made a dental appointment in August, and so we had to find out what's going on. So I will send this out to you guys to let you know. The bus holds 48. All the council are invited. It is not a sunshine, because they're not gonna be conducting business, so I heard all of you guys can come. All you guys can come. County commissioners are invited, school superintendent is
Just for the
invited.
record, it's not just that we're not conducting business, but we won't be actively discussing with each other any matters that could be voted upon.
Right, we'll make them sit separately. You can't do sign language or something, no, it's good. So anyway, it's exciting because this is community led, these are ambassadors led, and so on the bus, you'll hear from them. And on the walks, you know, sometimes when you ride, you miss things, so walking the neighborhoods, you can kind of see the pride that's in the neighborhood, and then you can see the vacancies that may be in the neighborhood, or people aren't doing the right things, or so. Anyway, gives you a chance to hear them. Hopefully, too, we can find out what they want done to their parks in the neighborhoods and stuff. It's a good way to start communicating that whole message, letting them know that they hear them. And so, superintendent will be on there. I'm excited. I think most of the people will be on the bus there, sending in their RSVPs, and so we'll let you know how that turns out. But
This
that's,
phrase is kind of, I know what it's meant by the word move.
Where's move?
Relocate might be a better.
Yeah.
Well, you
Why
shouldn't have
should-
to move, it sounds like you don't have, like,
You
you
should
don't
not
have
have
to
to move.
exercise or walk or.
All right, relocate, yeah,
Anyway,
relocate, I will put that on it.
I have a question about, so this goes along with that, right?
Yeah, this is all part of the
Do
grant.
we have information about how many individuals completed is this based on census data, or is this based on, survey data?
This right here was the beginning of the grant is census data.
Census data, okay.
Yeah, and we are trying to get, these community ambassadors are gonna go door to door to try to see if they filled out all the surveys. That's one of the things that ambassadors are
Do
doing.
we have, like, percentage of census completion within each of these tracts? I'm just wondering how much data was collected within each, the accuracy, right?
What do you mean?
Like, not everyone completes the census, of course, that's the goal.
Oh, yeah, right.
But what percentage of census completion was there within each tract?
Oh, I can check, that's what.
I'm just, because, like, let's say we
This
had
could be
2
right.
people fill out the census in the Wildwood School District, or in Census Tract 122, right? The data is obviously not gonna be very accurate. I'm just,
Right.
I would be curious.
Yeah.
Maybe there's a high enough percentage of census
Yeah, and
completion
I'm-
across all of them, but.
Right, and I'm thinking that this is the CDC's data, when they went down to the census tracts, and I'm thinking that would be the case with all data, right? It's always gonna be skewed between you, if you have.
Yeah.
Yeah,
But
so, yeah,
there's no,
yeah, I'll just.
that column is kind of I'm always curious, the accuracy, expected accuracy level. Okay.
Yep, but I'll check with her to look and see.
Okay, thank you.
Anything else about this, you guys? This is, when we were looking, this is, if we just go down the size, these are census tracts, they come down neighborhood. Cause you can really stand on one corner and put your foot on another corner and you're a different census tract. So they try to come down deep enough, cause we only have 2 zip codes in Middletown, really. And we really have 3 if we go over to that Franklin area, that 005, that's ours, and so that Warren County area. And then populations in there, and we try to look at the populations that's saturated in the communities too. Life expectancy, that's in there. Below the poverty guideline, unemployment, income, younger than 17, because we are trying to get to, when we look at kids, disabilities, single parents, minorities, and then no vehicles. And so we are trying to cross some of that data. And I think I can send that out to you too, the PowerPoint, the original PowerPoint. We have a current one that we can send out all this on top of the PowerPoint for you to go through. Christy just did a presentation, Christy Durridge, to, I think Rotary maybe, or someone, that she updated the data that we had, because we have more. If you guys can remember, she did it, dog bites, she did domestic violence, she did abuse in kids. And so we were looking at the data, crime, homicide, what else was it, Amanda, fires, crime, overdoses. She was just putting all the
Suicide.
data on the map, and it tends to be the areas that you have, this dark golden area, those are the census tracts that a lot of those issues fell upon too, so that's why. It kind of goes along with just the older neighborhoods, I think, the older distressed neighborhoods. So that's it, that's one thing I'm really excited about, the, Not Middletown group. I'm meeting with the city manager and a possible facilitator tomorrow to try to get some kind of direction of where they wanna go with the Not Middletown group. Not Middletown was a group that was formed after the 2 homicides. But again, I'm trying to suggest or lead everybody, again, to Destination Middletown. I hate when we do documents that are good that we're not using. And Destination Middletown is a very good document, and everything, if we did everything in that document, it would be, Middletown would be the destination, right? And so it's already out there before, so sometimes you start these other groups and you're like, let's start spinning off in this area. Destination Middletown, I guarantee you, if you look at this document, it has everything that we're talking about. The mental health issues, homeless issues, abuse of substance issues, housing issues, everything is in that document. So when we keep kind of squirreling away with the homeless and stuff like that, we can kind of come back together and look, how does this fit into our guide that we have, so that's exciting. And last but not least, I met with Ruth. We were meeting for different things that's going on in the community with, again, treatments and locations of the syringe exchange. We'll probably talk about that really quick, but a lot of good partners and a lot of good things that may come out of that. The library wants to work with us to help with coordinators in there to get people on the right track to find what they need or whatever.
I have a meeting with them after this.
Yay!
Yeah.
And then the courts is looking for a coordinator in the courts, that we may be able to get people in the courts, because all the people, when they say, we need this and we need that, it takes up time and effort and staff. So these are social workers and community coordinator workers that can maybe help leading and guiding people in the right direction. So just trying to put everybody in the right place or in the right lane. And then Sally, did you have any more about mental health? The mental health circle, did you have any update with that? Cause I think it's a bigger, meeting coming out with that, so. That's about it. Other than that, just doing the community health assessments and staff meeting. Our staff, I'm excited. You know what, you guys, I have to shout out the staff. Everybody in the state of Ohio is talking about not finding staff, short staff, staff quitting. I'll say this until the cows come home. City Health Department worked throughout the pandemic every day, and we did not lose any employees to death, because some people died, and I know you were like this. Some health department had people that passed away in it, or they didn't quit, I think sometimes we suffer a little bit from fatigue, but we're gonna use the workforce development monies, and I will let you guys know, how as we use it, but trainings, we may close down the office a half day or maybe a full day if it's good trainings where they can do some self-care and take care of themselves. I will be here, but the staff that can't run the office will not be here, so we're gonna do some of those things. So I really appreciate the staff. Every day I tell them, I was off, I don't know if you guys knew or not, but my best friend and my brother died, and I was sick. And so they held, yeah, and I was sick there the whole time. I don't know if it's stress, grief, or all the above, but didn't miss one beat of doing anything, just complete support. So I appreciate them, appreciate all that's done. Don't take it lightly, because we go to these meetings, and I mean, they're suffering. Everybody's suffering with staff and trying to find people. And so you guys got an excellent, excellent staff. So that's it. And I'm saying that to them for the record.
Wrote it down.
You wrote it down?
Yeah.
No, you can't have, okay. that's good.
Thank you, Jake.
Mhm.
Dr. Genowine.
Reportable illnesses, you have, reports in there, obviously. Chlamydia, we had 22, gonorrhea 5, hepatitis C, we had 6, B 4, we had 1 syphilis, and we had 1 carbapenem-resistant enterobacter. And that's all I have. Pretty interesting diseases.
Yes.
Everything's always interesting around substance abuse.
Yeah.
Does anybody have any questions about that for Dr. Genowine? Okay, Chandra.
Nothing too exciting to report. You know, COVID numbers are down, which is great. Outbreak numbers in nursing facilities are down. Vaccines unfortunately are down, but 'tis the season really for most vaccine numbers to go down. But we are still offering our vaccine clinics twice a month, upstairs here. We've moved out of council chambers because the numbers aren't high enough to need that much space. But they're still the first and third Thursdays of the month between 12 and 1 unless scheduling conflicts, but we're still trudging along.
Thank you. And do we have a version of Carla
I
here
do,
today?
I do. I'm the bigger version of Carla. Let's see. Steel City Pizza, that's 1330 Manchester. Yeah, we received their plans. And resubmitted plans for the Shell gas station, 6905 Lefferson, on corner of Cincinnati Dayton Road and Lefferson. So you guys kind of know where that is. Did we receive the plans for Mr. Hot Dog yet? Remember that was a newer one that came in?
We still haven't received.
Receiver plans getting out, because we often get things that we're waiting on the health department and we don't have plans, and so we're still waiting on the plans there. For that, Mr. Hot Dog is down there on the other side of Grandpa Joe's. On that.
We did receive plans for that just on Thursday.
Thursday,
late afternoon.
recently, because that's why, okay, so we got those. You guys know where
Is
those?
there a sign here?
Hmm?
Is there a sign for it?
Haven't driven by, I just know she didn't come in anything and drove off
Yeah.
the plans.
Okay, because I don't know where, it's Mr. Hot Dogs is supposed to be. Hot dogs, like that, yeah, so.
It's where Triple J's was.
Yeah, okay, so yeah. And all food licenses has been paid and renewed permits issued, swimming pool applications and campground applications mailed for renewal. We have 26 pools, 3 spas, those are usually apartments and hotels. 2 campgrounds, both located off of Carmody. Questions about those pools or whatever? Everybody wonders, well, do we still have pools? We do still have pools that we check and go out and check them.
Are the 2 campgrounds, one is the Faulkner property, is the other one the Riverside Village, is that still considered a campground?
I think it
They
is.
still have.
I think it is.
Riverside.
Riverside. Mhm. Person in charge food safety classes, 5 participants. There's another person in charge class, scheduled for April. And the rest, Carla had here was, about tobacco 21 that we already, spoke about. She said continuing to develop signage, application, and educational material, so we've already talked about that, so that's it.
Thank you, Carla.
Yeah, you're welcome.
Anything else anyone wants to bring up while we're still in session?
And we usually,
No.
Discussion should be on here, right?
Oh,
So, yep,
new-
that's
yeah,
what we
any
did, the
new
discussion
business.
part, yeah,
New
after.
business, anything, yes, any new business items? Throw- I think I somehow managed to work all of mine into the various conversations already.
I did have one other thing in the packet,
Oh, I
and I'm
actually-
not seeing in the packet, it was the SEP information. Remember, I think Sally may have requested, information about the
Yes.
needle exchange, the history, some of the diseases, and it's some information from CDC, and all that's in the packet, for you guys to look at as far as how the diseases, pros and cons of the needle exchange.
But for what it's worth, that was one of the things I was gonna, neither Hamilton nor Fairfield Mayor really knew about syringe exchange. Claim, so, they were not super
What
thrilled
mayor
about
did you-
having them in their city.
What mayor?
You know, you were talking about that needle exchange, I think the last meeting, you know, about cutting back or cutting
Mhm.
out or whatever. If you
Mhm.
look at the numbers in this tree that they sent me, it looks like if you do away with the needle exchange or you have it less, all your numbers go way up.
With like the Hep C and that.
Yeah, so it doesn't look like really a great idea, or maybe you can, change something, but it doesn't look to get rid of it, or not a good idea, it doesn't look.
Yeah, I think politically, when you were saying, I didn't know what mayor you said, but I know Fairfield, I know politically, no one wants it, and, I mean, it's always not in my backyard,
Right.
it always is that way, and we really would like, sometimes Middletown goes forward and does the right thing, and we would really like people to follow suit, but why should they? If they make sure the buses bring their people here, and if they make sure, why should they do the right thing? And so you're correct, I
Well,
mean.
because we're getting the people shooting up in the woods
Right.
behind the exchange, and that is not okay.
Mhm. Yeah,
That's not okay.
right,
Well,
So
we're getting
there's
people
new-
shooting up in the woods all over the place.
yeah,
Not
Yes,
just
but
behind the exchange.
specifically
Th-
after
They're gonna still
leaving
shoot up
there.
just with the dirty needle.
yeah.
And I'm not a total proponent of it, because there's two sides to these
Right.
exchanges,
Yeah,
sure.
I totally get
But-
that.
But that shooting up is not gonna go away whether we have the exchange or not.
But the
The problem is
Hamilton and
w-
Fairfield people are coming on the bus here to get their new needles and shooting up and leaving needles in our woods.
That is the
That-
problem.
that's what I'm getting at.
That is the problem, and we've talked about that numerous times,
Yeah.
about
Right.
Hamilton and Fairfield
Me
both
too.
kind of, and Butler County in particular, not following through with what we had hoped they would do. What they to
Right.
some degree implied they would do years ago and never have.
Right, and then it's becoming now, they're all coming to Middletown.
Sure. But
And
that's
so-
on many levels, not just the needle exchange. I mean,
Absolutely.
Yeah,
We
yeah.
get all sorts of people from those same locations to our city
Yep.
for multiple different reasons, and they don't seem to mind that.
Right.
Yep.
And the question is, do you stop doing things that you know are good just because no one wants? I mean, it becomes, okay, we can just stop doing it, but then that hurts the whole group of people as far as on both sides, right? Our health, professionals, police, fire, whatever, anybody that deals with them, when you're in the hospital, if you have hepatitis C, hepatitis B, hepatitis A, HIV, whatever you may have that can spread communicably, then does that help the whole system? Does that help the financial system? Remember, we talked about how much hepatitis C costs, and so, I mean, we get into this discussion again, but let me tell you, I am often, and Sally knows, cause Sally was at a housing meeting, I'm very vocal about recognizing what Middletown's doing and what other people are not doing, and I say that all the time. So, we have talked about having a syringe exchange on Route 4, right? So that would be in Butler County, right? And it would be on Route 4 where it's on the bus line, and so it wouldn't be anywhere, they have to wait for that bus to get back home wherever they're going, but it would be like they have to just come in and out, and it's not like dropped off, cause it would be no place to go. Maybe that's not in anybody's, back door, backyard type thing. And so then the use would be on Route 4, the needles would be just dropped on Route 4 or whatever. But I'm just saying, we try to make sure that everybody gets the effort. Now, Oxford's supposed to be opening up their needle exchange, and they wanna do, but they don't want anybody else's either, they want theirs. And so we talk about that too. If Middletown closed, will everybody go to Oxford? And that would be a terrible thing, and then they would close down too. So, the discussion's out there, they recognize that what would be the best thing to do. The mayor in Fairfield, it's shame that he doesn't know that it's in Fairfield, and it's in Mercy's parking lot, and it's been there
He
for,
didn't.
so, a lot of people
It's been
turn
there
their
for
blind
years.
eyes to, but it's been there for a while. Fairfield's syringe exchange has been there, and it's been going up, and if you look on your report, it reports the Fairfield exchange numbers, and so.
Maybe I misunderstood what he was.
Yeah, but I know when Hamilton was courting me, they said, we would love for you to come be our health commissioner, but don't bring that needle exchange stuff down here, so I know how they feel. I know how they feel about that, but, sometimes it's about doing the right thing, not what we like to do, but, it's just up to you. We were gonna try to make sure that everybody shares their burden, and I tell the commissioners all the time, you wanna give us everything and no money, so help us, support us in our initiatives financially if you're not gonna help us, with different locations. But, I don't know, in a perfect world, everybody would share burdens, but that's a perfect world, that's a whole nother discussion.
One other thing, real quick, the Amanda Sewer issues, do we have any update on that?
I do.
Is it anything brief you could, no, it's lengthy, okay.
Lengthy, we can bring it up next time, but I
Okay.
think,
I just don't wanna keep
I know.
kicking the can, I don't wanna be
But-
the group that kicks the can.
I don't know if the health board, I guess I don't know, I have to look and see, cause the sewers would be all public works, right? And then
Right, I'm just
yeah.
thinking if it is a health issue, the Board of Health could help champion the push for
Right,
it, like if.
right. Yeah, I will get back with you on that one, cause I think we are trying to work on some, what do you call it, resolution, but I think it's pretty lengthy.
Okay, thank you. Anything else? Okay, with that, we will adjourn our Board of Health meeting until May 9th. May 9th at 7:30 a.m. here in 2C.
you.
Thank you, guys.